So now let's get started with a more important topic of today, which is the thoracic inlet. This is also known as the superior aperture of the thorax. We all know that the thoracic cavity is basically shaped in a way of a truncated cone. So it's basically shaped like this. So the upper end is narrower while the lower end is larger, and we all know in the lower end there is the diaphragm. And the upper end that is narrow, that is known as the thoracic inlet. So the inlet is basically bound anteriorly by the upper border of the manubrium. So this is the sternum, the upper part of the manubrium. On either side lie the first rib, and posteriorly is your first thoracic vertebra. This area basically giving way to entry of vessels, organs, to various veins and nerves, etc. So this is giving the entry, and all of you know that this is located right at the root of the neck, this area. This is the neck and it lies right here. So let's discuss about this aperture a little more in detail. So for example, this, if you are looking from the lateral side of your body, this is the manubrium and this is the T1. What's important here is that the plane of your thoracic inlet is directed downwards and forwards. It is oblique with an angle of 45 degrees to the horizontal. Hence, the manubrium is coming to lie in front of the T3 vertebra. It is important to know that the plane of thoracic inlet is directed downwards and forwards. What are the various structures that pass through the thoracic inlet? First, let's talk about the organs. The organs consist of obviously that organ that passes from the neck and goes inside to connect to the stomach, and the organ that passes from the neck goes down to connect with the lungs. So these are the trachea and the esophagus. Moving on, we have another important organ. These are the apices of the lungs. A singular is apex of the lung and plural is apices. So the lungs basically, they have an apex which basically cross the inlet of the thorax. Then we have the remnants of your thymus gland. Thymus gland was your lymphoid organ. These were the main organs that are passing through the thoracic inlet. So what are the large vessels that are passing through this thoracic inlet? These are, let's classify them into right and left so it becomes easier for you. So on the right side pass the brachiocephalic artery. Now this is a branch of your main aorta which is coming from the heart, and on the left side there are two arteries. It has the left common carotid artery and the subclavian artery, left side. What about the veins? The veins are pretty simple. The veins on both sides are the brachiocephalic veins. So the right brachiocephalic vein and the left brachiocephalic vein. These were the large vessels. Apart from this, there are a couple of tiny vessels that also bear entry through this inlet, and those are right and left internal thoracic arteries, superior intercostal arteries, first posterior intercostal veins, and the inferior thyroid veins. And finally, what is important are the nerves that are passing through the inlet, and these nerves are nerves that obviously have to pass through this inlet to go to the diaphragm, which is the phrenic nerve. So the right and left phrenic nerves. Apart from this, there is a nerve that comes from your brain or your cranial area to go and supply inside your thorax, which was the vagus nerve. And then we have the sympathetic trunks. The discussion of sympathetic trunks will be done later in this chapter, but these are very important structures that pass through the thoracic inlet. So the right and left sympathetic trunks. Finally, the most important nerve that we studied in our upper limb, which was the Tt1 Thoracic Nerve. Now, what was the T1 involved in? It was basically, it's going to pass outside of the aperture as it has to go and join the brachial plexus above. So this is the T1 spinal nerve or the thoracic nerve, which goes above to join the brachial plexus. So T1. So these are the important nerves and structures along with the vessels and the organs that pass through the thoracic inlet. Now let's discuss a couple of clinicals related to the thoracic inlet. The first clinical I'll talk about is definitely the thoracic inlet syndrome. The cervical rib is basically, in some certain people, in about 0.5% cases, an extra rib is given above the first rib. So the structures that were passing above the first rib, now they have to pass through this, and this causes the compression of these structures. So there are two structures, the subclavian artery and more importantly the T1 spinal nerve that we just talked about. So the first thoracic nerve, when this is compressed, it will give rise to paresthesia and hypoesthesias in its area of distribution, which was mostly the ulnar border of your entire upper limb. Apart from this, it supplies the intrinsic muscle via its branches, so the intrinsic muscles will undergo wasting. Apart from this, due to subclavian artery compression, there can be ischemia and pain in the sites of its distribution. Another very important clinical is the coarctation of aorta. So coarctation, what does coarctation mean? Coarctation means the narrowing of something. So the aorta that is coming from your heart is getting narrowed. So we are talking about your descending aorta right now. Descending aorta, the blood flow is going downwards, all right? So what happens is the aorta, in its upper part, it has given a branch called the subclavian artery. The subclavian artery further gave a branch, internal thoracic artery, and internal thoracic further gave a anterior intercostal artery, all right? So this anterior intercostal artery will be linked with the posterior intercostal artery. Artery is a branch of the descending aorta. So what happens if there is blockage of the blood flow here? It starts backing up. So when it backs up, it will go through the subclavian artery. Through it, it will go to the internal thoracic artery. Through it, it will go to the anterior intercostal artery. And anterior intercostal artery being connected to the posterior intercostal artery will take the blood back finally into the descending aorta, and a collateral or bypass channel has been made so that the blood does not have to pass through this narrowing. What is the consequence of this narrowing? The consequence is that since there is so much blood in these tiny arteries, these arteries start to undergo becoming tortuous. If this is the rib, these arteries start to become tortuous and undergo notching on the rib. So this was an important clinical.